Good afternoon, all. Thank you for InterSystem for having me. Allow me to introduce myself first. My name is Benedict. I'm from RS Premier and now also managing Columbia Asia Hospital as well. Now, this afternoon we'll be talking about cybersecurity in healthcare. As we know, cybersecurity has becoming one of the major constraints in IT development all across the world. Yeah. Few weeks back, we have an incident. I believe almost everyone here know about it. Who has been infected by CrowdStrike that time, around 3 weeks ago? Not many. Yeah, because almost the major businesses in the world face that problem. We also got that as well. But that's part of the security measures that we need to obtain. So I'll be talking about cybersecurity in healthcare based on the best practices, not mainly what already happening in my hospital. So in Bahasa, when we talk about kenyamanan, yeah, it doesn't always the same with keamanan. Yeah, it's always contradictory. Maybe only have slight differences in terms of wording. Yeah, but convenience never the same with security. What do we need to do in order for us to secure our environment? First, you need to know your deficiencies and your priorities. If you don't know what are your deficiencies, then you can't do anything. If you know it already, but you cannot prioritize, then you always have a problem. So you need first to identify, you need to analyze and manage your risk. So this is the basic concept of every security measures that you need to do. Yeah, whether you are a small hospital, medium hospitals, or a large hospitals. Yeah, this is like a snapshot about the global cybercrime damage cost in 2021. We can see that $6 trillion a year, up until $190,000 a second. Yeah, so like what we are speaking as of now, it could be more than that. So let's see what happens in 2023. 8 trillion US dollars a year, up until 255,000 US dollars a second. Yeah. So imagine if we are part of that problem, yeah, we got the ransomware or all those issues, we could be having that sort of losses. Now you imagine if we need to calculate that and then put it in your IT budget, put it in your security budget. I don't think that our budget will be up to that number. Yeah. The top 15 of the cyber threat from ENISA, mentioning the first one is malware. It's always been the first case because malware can be infected from anything. It can get from email, it can get from USB disk, anything. Even up to now, when people are sending messages or attaching any file or documents through WhatsApp, Telegram, and you open it through your notebook or laptops, it can still infect you. Yeah, so malware is the first one. Yeah, up until phishing, right? In our new hospital nowadays, they have a standard that we need to do a monthly phishing assessment. Now, surprisingly, 30% of the users are always caught up. Yeah? Every month, they conducted a test pretending to be sending out email phishing from HR, from the CEO, or from the doctors, and mostly from the HR that got hit the most, yeah? Especially when they're talking about allowances or bonuses. Then people will click it anyway, yeah? Well, that's the problem. Now, we're talking about healthcare now. Healthcare is growing. Now, we're talking about AI, all the digital transformation, but is it secure enough, right? Previously, when Dimitri was presenting about the AI, he was talking about, okay, when this recording been sent out, right, and then got analyzed, turned to AI, then it becoming all the text, right? Now, problem is, can someone make the changes on the text? Can that can those texts also be intercepted for any man in the middle and got those information? Possible. So doesn't mean that all the technology is secure enough. You still need to secure it by yourself. Yeah. First one that we need to look upon, the third-party integration. This is the key. Before we are transforming ourselves, connected to each other through APIs, we are standalone. We do not allow ourselves to be connected to the other systems. Maybe around 15 years ago, the EMR or the system that we have maybe just sit alone in the hospitals by themselves, not connected to each other, even though the network could still be connected. But now with the API, certain security needs to be in place, right? You need to have an API gateway. You need to use certain protocols, yeah, OAuth, whitelisting, anything that you need to, of course, in sync with the other partners, right? When you also use cloud computing, what sort of cloud computing are you using? Is it public cloud, private cloud? What will be your security measures, right? We have AWS, we have Microsoft Azure. And also, what about your data governance? Are they compliant with our regulation? That we need to look upon, right? When we look into mobile application, does our mobile application developed by ourselves or developed by third-party vendor? Is it being hardened? The communication between the mobile application to our server, how is it connected? All of those things will need to be measured, and that's what we have to do the hardening process. It's not easy. Yeah, there's a process, and every time that we make the changes, that hardening process needs always to be conducted. Yeah. Same thing with patient portal. What sort of security for our patient to be accessing our patient portal? We could say, okay, but we are sending you OTP. Maybe people do not recognize, oh, OTP for patient portal is not as dangerous like OTP for banking. Doesn't matter. OTP is an OTP. You can still use it for anything. If people can get into the system, they can obtain the data, then they can use it for anything else, right? Medical devices integration, yeah. Patient monitors, telemetry, lab devices, all can have integrations. What sort of method is it using, right? HL7, that's only the protocol for the communications, but what's the security, right? Imagine if someone can intercept and make the changes and then put the different number or put a different diagnose in your system. Who will verify those things, right? Remote monitoring. Now, this is for things like home care, right? We have nowadays like wearables, people coming into the home, putting in their informations, but how is it going to connected to the core system, to the hospital information system, right? That will also need a challenge. So in all these cases, we are talking about interconnectivity, yeah? And also interoperability of the system, where actually connectivity needs all to be secure. Now, last but not least, we're talking about printed materials. Yeah. In the old days, people still printing lots of things. Yeah. I said this to Paul and John when they're visiting our hospital a few days back. In my previous hospital, we managed to find some people rummaging our trash. I mean, in the major trash behind the hospital building, taking care of all those the forms and everything that was discarded. Why? They taking out all the labels. Because why? They have the names, they have the date of births, right? They can use it for anything else. People not noticing. So they don't have the awareness for that. And after that, yeah, we discard it properly. We shred it out, so no longer we are printing out too many forms or printing out too many labels. Yeah. So let's see what are the known cyber incidents in Indonesia for the past maybe 2 or 3 years that we have. Yeah. So top Indonesian government hospital attacked by WannaCry in 2017. Anyone knows which hospital? Huh? Yes, Damais. Luckily, that time Damais was in fact impacted, not all, only like 70 PC as far as I know. Yeah. And what they did, they just formatted everything, then it became the normal. Why? Because it impacted only the PCs. Imagine if it impacted the servers, right? Well, to be honest with you, I don't know whether there are any other hospitals that been hit by ransomware to the servers and already need to pay up the ransom. Yeah, because definitely it's part of the reputation here. And then BPJS, 2021, the data was sold onto the dark web as well. Yeah. In Australia, Medibank also got hit. COOP ransomware, this one is attacking Microsoft that time, yeah. Bianlan in China, yeah. Actually from China attacking the California healthcare facility in Virginia in 2022. Lapsus ransomware, Brazilian Ministry of Health, so doesn't mean that if you are the government, you are secure, yeah. People are still going to attack you. Yeah, Killnet, this one doing the DDoS attack. So maybe they are not going to take your data, but they're going to do disruption to your services that will impact your operational activities. Yeah. Then Montana, this one is a top threat actors targeting healthcare sector, and they're targeting SQL injection. Yeah. So why healthcare sector is being targeted? First one, patient data and information are valuable and essential. I mentioned earlier, and it has linkage to any other industry. Now, for instance, in our patient data, we have NIK, the national ID number, right? Now the government already said, okay, it needs to be connected to the tax, right? Tax then connected to banking. Yeah. Say that someone else already obtained all those data, they would like to go to a certain bank branches and then, hey, I'm that guy. These are all the data. These are the mother's maiden name number. These are all my addresses, and all match. Banking may not have all the necessity to recheck again. Maybe they can still use the KTP reader, eKTP, but maybe not all. Yeah. And then the ease of intrusion. Like, I mean, our hospitals in Indonesia, we have different classes, right? A, B, C, D, right? Not all of them have the same level of IT standard, right? Not all of them have the same understanding for the security posture. Yeah. Maybe we can say, okay, in the D class hospital, they are using unmanaged switches. They are not using firewalls, maybe for instance. They are using Wi-Fi, using maybe home-based Wi-Fi like Tepeling or Deling or Tenda, you know, who actually lacking security measures, unlike maybe the big hospitals, right? And this was not actually being measured and defined by the ministry, unlike with the banking, for instance. Banking in Indonesia, Bank of Indonesia defined all those measures. They stated, like for instance, oh, for you to connect to us, you need to have an HSM, yeah, hardware security module, which in the costing could cost you up to 1 billion rupiah. And can our hospitals commit to that budget? Maybe not, right? That's why if we now have to connect to Satu Sehat, but doesn't have proper security measures, that's also going to cause problems, right? I talked about this with Pastor Tiaji that time. But if there's any problem with the data, and say, for instance, the government got breached, then the patient, based on the PDP law, sue us back because we have been breached, the data has been leakage. Who should be responsible? But then it's a shared responsible. That's the reality, and it is stated in Undang-Undang 17. Yeah, but we cannot be like that, right? So we need to know that and secure ourselves. Yeah. Third one, I'm putting it like this: lack of IT security awareness. Yeah. So when people are talking, so who should be responsible for IT security? It's IT. It's IT security. It's cyber security. It's IT. No, actually, it's everyone else. Yeah, not only IT. All of us needs to be responsible. Yeah. When your doctor refuses to change password regularly, they also responsible. They don't want to have a complex password. When we force them to change every 3 months, they say, "Oh, it's making us a hassle." Yeah, because this making us inconvenience. Why are you closing the access to the internet? We need access to the internet. Then I said, for what? Yeah, I need to watch YouTube. Come on. Yeah. Okay, and then fourth one. After COVID-19, healthcare in Indonesia are transforming really quick, right? Before COVID, right, we do not see many integrations. We do not see many collaborations, even with the insurances, even with the third party, or even among the healthcare, right? I just spoken with Pa Andri. We are actually discussing host to host, maybe already for 3 months ago, right? Because we have some referral lab that needs to be sent to Prodia. And we already communicating, thinking about this since 3 months ago. And one of the hiccup that we are still facing is about the security, right? But at the end, we need to come up, okay, this is what we are going to do. And then this is how we are going to do it, right? So an agreement must be in place for both parties at the end. Yeah. And this is the last one, low digital maturity level. From Percy, yeah, ever since 2022, they conducted a digital maturity level survey, right? And the 2023 result came, and only 30% out of the hospitals in Indonesia who fill it up, right? And out of that 30%, only 35% are actually in the level 3, from 0 to 7 level. So even still below 4. Yeah. So still below the minimum standard. So plenty of things still need to be conducted in the hospital. Yeah. Now at the end, if these things are not being managed, the impact will be resulted into the potential costs. For patient, identity theft, blackmailing, insurance fraud, financial fraud, all of these things can happen. For us as the healthcare providers, reputational damage, legal risk, financial burden, and trust issue. Definitely, if it's already impacted, then really hard to recover. Yeah. Now we are talking about the prevention and what are the best practices for the cybersecurity approaches. Okay, we need to have a standard. Yeah, there are plenty of standard in the world, like for instance NIST. Yeah, this you can do it by yourself. You can do a self-assessment, and based on the management input, also you can prioritize. What are the things that you need to prioritize? The second one is ISO. Earlier, even Pastor Tiaji mentioned they already completed 27799, which is the Hospital Information Management Security ISO. Yeah. While the standard one, people always talking about cyber security. Yeah, the common one, ISO 27001. Yeah, mostly on the information security. But 27701 focusing on the privacy. Yeah. So these are the standards. Now, what should we do? We can do some sort of like a pre-assessment. Like 27001, there are 14 annexes, right? Then we can do a self-assessment, or we can conduct an external surveyor or assessor to assess us. And then so we can know our security posture. Yeah. Then afterwards, you can define your strategy, at least in some cases, like within like 1 year, 2 years, or 3 years. Oh, you want to be like this. You want to overcome this annex. So at least now you have the grand design. Yeah. This is, for instance, the example of NIST, right? So if the one that has been defined is actually the purple color, and the coloring for the green one is actually the achieved one. Yeah. Next one is defining your IT security standard. Why do you need a standard? Yeah. Why is it necessary? So you need to define those things. Yeah. Next one, where are you heading? How far you would like to get protected, right? Now, obviously, you need to adjust this with your company's objective, right? The one that most suitable for you, that's the one that you need to look upon. Like for instance, okay, we know that the best firewall in the world up to now, the one in Gartner level is Palo Alto. But do you need Palo Alto? We might not need it. We might need only like Fortinet. Yeah, just go with Fortinet, right? So that one you need to know where are you going to heading, right? What is your current policy and OCP? What is your risk appetite? Now, if your risk appetite is not the same, right, in whole the management level, of course, definitely that's going to be different. Yeah, it's always been a problem. They say, okay, this is what we would like to secure, but the management said, okay, we don't have enough budget. If you don't have enough budget, will this be your level? Like for instance, but Ben, I don't want the server to easily go down. If it's go down, at least 1 hour can recover. Okay, that's the RPO. Yeah, the point of restore, 1 hour. Then calculate whether your DR can support up to 1 hour at least. How much does it in terms of your applications, in terms of your servers, your backups, and everything? And if it's according to what you need, do it. Or you select, oh, now I would like to have a high availability, 24/7, no disruption whatsoever. Even from the perspective of the users, there's no changes. Okay, then the cost will be much higher, right? Do we need that? Maybe a certain level of hospitals going to need that. But if you're saying like, okay, D-class hospital, C-class hospital in Indonesia, why not? Who are the stakeholders, right? You need to define who are the stakeholders. Earlier I mentioned about the responsibility, right? It needs to be clear. Next one, when are you going to need it? Are you going to need it now? Maybe a year from now? Or incidental when there are problem happening, right? In my previous company, I learned about the term 10, 100, 1000. So if you prepare it carefully, then the cost is 10. If you make changes in the middle, the cost is 100. But if you're making it afterwards, at the end, after all things happen, the cost is 1000. So it's 10 times or even 100 times difference. Why? Because it's already happening. So preventing is always the best solution. Yeah. How you can achieve it? Definitely, we have what we call PPT. Still remember PPT? People, process, and technology. So it's not only about the technology. We already invested a lot, but if you do not have the people to manage it, problem. You do not have a proper process to monitor, also problem, right? So it's always been like a comprehensive approach, yeah, for security. Next one about the preventive measures, yeah. I would like to give recommendation, always up to date in terms of your infrastructure and software, yeah. Never use end of support application, yeah, end of life application. When I can still see in many hospitals, we are still using XP or Windows 7. Yeah, people have limitations. Yeah. Now, also the next one, don't use illegal application and unknown application. Hardening, no, you need to do hardening in your network services. Yeah, segregate your network on by VLAN and also doing the data encryption, updated antivirus or endpoint security. Yeah, robust authentication method. You can use MFA, not only using MFA for VPN only, but you can use it also for entering your HIS. Yeah, my new hospitals nowadays they use the Microsoft Authenticator already to get into their system. And I said, "How's the response from the doctor?" Yeah, the doctors is against it So now the authenticator is being carried by the nurses. So I said, you have a very good process in place already, but still people trying to go around it. Is it useful or not? Yeah, that's a problem. And then frequent IT security awareness. We need to tell people a lot. Yeah, that's why we need to have IT security, people who are responsible for IT security in the structure. If you don't have that, then you can invite people from external parties to do it for you. Yeah. Next one about backup. When you are when you're in an enterprise level, backup is no longer can be bargained. You need to have it. Yeah. And the standard has always been the same. You have an online backup and you also need to have an offline backup, right? We heard about PDN, the National Data Center. They don't have proper backup. And if they have proper backup, they don't have offline backup. And that's the first one that was attacked by the ransomware. Good disaster recovery plan. So you need to practice it. You need to do simulation on the recovery plan, right? Because when you are recovering, it's not only IT job to do the recovery, it could be the other unit as well. Test your data backup. Right? Sometimes you already back it up, but you never test it. When problem happens, oh, the backup fails. Useful, right? Useless, right? And then conduct regular user access review. User access management, this one has to be conducted, right? When people got rotated, when people resigning, you need to properly do this. Yeah. And it's our job to do it, right? The HR job, the IT job, it's a comprehensive effort from everybody. Competent and sufficient IT. So you need to calculate your requirements on our IT resources. You need to segregate duties. In several hospitals, especially older hospitals, they are still saying IT is IT. Yeah, IT for all. Please don't do that anymore. You need to segregate their duties. That's for risk management purposes. Who is handling the infrastructure? Who is handling the development? All have different security measures. Yeah. External assessment. This is earlier I mentioned about knowing your security posture. You can go with things like security scorecard, right? At least for you to know where were we at the moment, where are we at the moment, right? And where we are going to heading. Conduct a regular pen test, especially for a forward-facing or internet-facing application. Yeah. Cyber security assessment. This is also to continuously improve ourselves. And then SOC, 24/7 Security Operations Center. If you already having this also a big bonus because they will help you. Yeah. And then this is the last one, cyber security insurance. When all those things already prepared, but problems still can happen, right? You're still going to need this. Yeah. And this is not common, especially in Indonesia. But this is needed. Why? Because now we are heading to that level while cybersecurity is already getting there. So when this problem happens, you need to have money, right? Not just only for medical malpractice, you need money for in data got breach, to recover, right? To face litigations. You need the insurance still. Yeah. So this is only the explanation. So later on you can see the details. Now, I would say for the biggest threat still be coming from the people themselves. Yeah. So most of the attacks comes from the inside. The PDN comes from the inside as well because the credential was leaked. Now, that's why we need to do what? First one, we need to improve our awareness, conduct continuous security training. Don't be soft. Yeah. Most of the security guy always be the hateful person in the organization, right? But they need to be strict. And then if we are talking about architecture, go back to basic. Close the door and open only the few, right? You only need to open if you need it. You cannot open everything. Yeah. And this is the most important one. leadership support. So you need to get the buy-in from the management. Yeah, if you do not get the buy-in from the management, from the shareholders, it's not going to happen. Yeah. So I know that the time is up. Later on, I have still some part of a slide actually talking about in related with the deployment of our HIS, right, in terms of the security. But I think this can be shared later on because I know that my time is up. And thank you. And if there's any questions, please, you can contact me directly. Thank you.